Chemotherapy is a topic that I think is confusing for patients and families, often because of what preconceived notions patients' families will have about chemotherapy. I think chemotherapy gets somewhat of a bad name as being something that will just make you sick and not really help you. There is a risk after surgery that cancer could come back. And that's why we've been trying to discover and find better therapies for patients. And so now, in addition to surgery, we talk about things like chemotherapy and sometimes radiation therapy. What I often tell patients, though, is chemotherapy has improved in all cancers to a point now where patients can get this in a safe environment and don't necessarily have to feel sick and feel bad. And what's important to understand that often surprises patients and families is that chemotherapy helps. And what I mean by that is when you take a patient it's been discovered that they have a type of situation where surgery is not going to be a realistic option, and you don't give that patient any form of therapy, chemotherapy, and you take another patient who, say, is the same stage, everything else is similar about that patient, but you gave that other patient chemotherapy, the difference we know without question is that the patient who gets chemotherapy will live longer. Also, chemotherapy will improve the quality of that person's life. And I think that always sounds surprising. How could getting a treatment that maybe would make me sick, how could that improve the quality of my life? And it's because chemotherapy helps delay the growth of cancer. There are many drugs out there and recipes of different types of therapies. What's important is that a person gets a treatment, whether it's recipe A or recipe B, that they're getting some treatment. That is what's important. That is better than not getting a treatment at all. That radiation is given by a radiation oncologist, so it's not done in an office like where I work, which is where chemotherapy is administered, a medical oncologist's office, but a radiation oncologist is one of my colleagues who will administer radiation therapy. Radiation therapy is also something that can be done in a way that doesn't have to make you feel bad. It is something that's daily, so you'll receive radiation on a Monday through Friday type of schedule, but the treatments aren't long. It's not as if you're spending hours in the clinic getting your radiation therapy. Some patients will park their car, go in and get treatment early in the morning, come right out and go on to work, and they'll do that for several weeks while they're finishing their therapy.